Hello, I am Steve Forzato. I am the director of the Center for Addiction and Recovery Education at St. Joseph's University. And I present to you the Naloxone module in our Phoenix training program. Our Phoenix training program is funded by the Center for Disease Control and the Pennsylvania Department of Health. Our Phoenix program is on addiction, on substance use disorder, and how to connect people to treatment. It really does provide the tools for first responders to fight this opioid epidemic and more generally all drugs and addictions that we experience every day as we go through our daily duties as first responders. We are, as I said, partnered with the Pennsylvania Department of Health, and also we have partnered with the Hazelden Betty Ford Foundation. Hazelden Betty Ford is a treatment center, and they have many decades of experience treating people for various addictions. They have been around for a long time, and so certainly named after Betty Ford, who on her own around the 1970s came out and said that she had a problem with pills and with alcohol, and she sought treatment and it worked for her. I think one of the most important things that we can say is that substance use disorder, addiction, is a treatable issue. It is something that people do recover from and can live the rest of their lives very normally because they went through treatment and they have various recovery supports in place in their lives and live very meaningful lives. And so when we talk about this particular module, naloxone, it's important to remember that people do recover from addiction. And so when we as first responders administer naloxone to save the life of someone who's overdosing from opioids, there is often hope at the end of that. There's recovery at the end of that. Maybe not the first time, but maybe the second time or the third time. It's just important to remember that we're not just saving people for some immediate turnaround. Sometimes it takes more than one effort at treatment and at recovery for it to stick. But when we do naloxone and use that medication to reverse an overdose that would cause a death, there is hope. There is the ability for someone to recover. So let me introduce myself. My name is Steve Forzato. I am from St. Joseph's University. Prior to joining St. Joe's in around 2019, I spent 33 years in law enforcement in Pennsylvania. Let's just first back up just a little bit and talk about naloxone. Now, Narcan is the brand name of one type of naloxone medication, and there are other brand names. Most of us are familiar with Narcan, and so we'll talk about that and maybe another. Narcan is a nasal spray, so it's very easy to use, very easy to sort of monitor how it's working in a person that is overdosed. And so we'll talk about Narcan. But the main thing about Narcan, it's simply a tool that saves lives. And so we're familiar, first responders are familiar with the tools of the trade. So, policing is something that obviously I spent 3 decades doing. We have certain tools that were issued to us, and many of those tools we get trained on. For example, a firearm, right? We're always training on accuracy and judgment and decision making when it comes to firearms, handling firearms. And that's a tool that we have. For patrol officers, it's on our tool belt. And for detectives, undercovers, we figure out different ways to carry. But that's a certain tool. Just like Narcan is a tool. We have radios, we have flashlight, handcuffs, tasers, and so forth. And these are all tools of the trade. Some of the tools that were issued as police officers are more like skills, like CPR. All of us are trained on CPR, and we're prepared to use that both on the job, at home, on vacation, visiting our grandparents. All of these tools, like all the tools like CPR and first aid and so forth, are beneficial to us professionally and personally, right? And that's something great about having those abilities. So if we're at a party and somebody's appears to be a cardiac arrest, a lot of people will turn to us that know that we're in law enforcement and say, hey, what are you going to do, Steve? Tools and skills to help choking victims. That's something else that many times, even in our private lives, we end up having to use. Narcan is just that same thing. It's a physical product with some skill to apply that product. We can save lives both on and off duty, and I will always emphasize that. I carry Narcan all the time. I carry it while I'm at school. I carry it while I'm out on the road doing some training. I carry it on vacation. I take it with me on the plane. Like, this is something that I'm really happy to have with me at all times. All right, so in this video, this is John and Robin, and they are big supporters of law enforcement. And they are people that, when asked, they came to a filming session for our program to talk about their son who was saved by someone carrying naloxone.
About 4 years ago, I went to California to say goodbye to my son. I just went because I knew I'd never see him again. And he was saved 3 times. He was brought back 3 different times in his life. And the last 2 times were what made me go out there. And that's the idea, is to just keep them alive for one more day. And now our family is today completely clean and sober, from grandparents on down, which is us. And the joy of our family being together, and again, everybody kind of being the best person they are, it's beyond words. And my gratitude to these anonymous people that saved him, it just never goes away. When my son was still not clean, and the raging post was debating over how many times we should Narcan a person back. And there was probably 8 people on the post. And the one thing they all agreed on was there should be a limit. They just didn't disagree on what the limit should be. I mean, they couldn't agree on what the limit should be. And there was my godson running the post, who I love, and he's a really empathetic guy, but he just felt that way. And so I jumped in and I just said, my prayer is that if ever someone you love is in that position, I hope they give them Narcan. And I think that's another thing about Narcan is, when I wrote that reply, that post went dead because it became personal. And if we can make the debate over Narcan personal, if we can bring it to people's hearts and suggest what it would look like in their life, I think we'd be able to get more positive responses in integrating it into our communities.
Carrying naloxone is a great department policy, making sure that you have it with you all the time, that you don't leave it back at the station, but you have it with you all the time is really critically important, because you could save a life, and it's very easy. It's not like CPR, first aid sometimes. Using naloxone is actually a very simple life-saving measure for us and for anyone that carries it. So what is naloxone? Naloxone is a medication that reverses an overdose caused by opioids. Opioid toxicity can cause death, and often does cause death. And we talked about in our prior program that you saw that there's about 107,000 Americans dying every single year, more than 300 a day on average, and from substance use. That doesn't even include alcohol-related deaths. So when we sort of nail this down to drug use deaths, about 70% of those 107,000 are dying from opioids. Opioids are very powerful and they impact people in lethal ways every single day in America. Way too many Americans. In Pennsylvania, it's about 5,500 a year. About 13 a day die from drug overdose, and the vast majority of those deaths are from opioids. When I say opioids, I mean heroin, fentanyl, substances like that, prescription opioids, Oxycontin, Percocet. Those are the category of opioid-related drugs that are out there. Naloxone does not reverse an overdose from other drugs like cocaine or even methamphetamine, and certainly not alcohol, right? Naloxone, because of its makeup, really does, and we'll explain this in a minute, it hits that opioid receptor that's causing the death because of the strength of the opioid or the amount, the quantity of opioids in someone's system. However, and this is a big however, as you know, drugs like fentanyl, which is an opioid, a very powerful opioid, about 50 times more powerful than morphine. And often fentanyl-related substances that are even more lethal than just your average fentanyl is often mixed into cocaine, into methamphetamine, into other drugs. Sometimes the prescription pills that are on the street, they might be labeled to be something like Xanax or some other type of medication, but oftentimes they're simply fentanyl that's pressed by a pill press to look like some other type of medication. And so there are some pills on the street, as you know, you see it on your daily duties, you hear about it in investigations, and you certainly see it in all the police reports nationwide and the media reports. Oftentimes this fentanyl is very cheap for the cartels to make. It's pressed into a pill to make it look like a normal, maybe not so powerful pill. Bottom line, because it's mixed into the drug supply, pollutes the drug supply, if you come across someone you know is a cocaine user or a methamphetamine user, and they have all the symptoms of an opioid overdose, which we'll explain in a second, it very well could be that that person either knowingly or unknowingly took cocaine, meth, or some other drug, thinking that it was just what they ordered, but it's actually polluted with this fentanyl. Very powerful fentanyl. So even in those cases where they exhibit all the signs of an opioid overdose, still administer naloxone, because it may not be the cocaine or the meth that's killing the person. In fact, often those drugs don't immediately kill someone. They have short and long-term impacts on one's health. But if they're exhibiting the signs of an opioid overdose, then absolutely administer naloxone. It will not harm someone, by the way. So when you look in the box and you'll see the directions and the manufacturer's comments about it, naloxone does not harm a person. If we misdiagnose what we think is an opioid overdose and it happens not to be accurate, we're not doctors, right? We're first responders. And so if we misinterpret the signs of it, the drug itself, the medication itself, will not harm a person. Only impacts the opioid receptors. By the way, naloxone cannot be used, and is not used, because everybody knows this on the street, is not used to get high. It's in fact the anti-high. And so I just want you to keep it in mind that are going through your jurisdiction and, I don't know, you have a case of naloxone, which is about 12 boxes of them, and 2 doses each in each box. If you mislay a case of naloxone, there's no reason to panic, because the people on the street that are seeking substances to get high, everybody knows that this is not a get high medication. And so there really is no value to it. There's no addictive properties in naloxone. So people won't use this all the time because they get addicted to it. It's not that type of medication. It's very safe. And fortunately, many people that suffer from opioid use disorder shy away from even having it. The moment it's applied to them, they lose that high and they start to feel the withdrawal, the pain that they suffer when they don't have the heroin, the fentanyl, etc. So It's considered safe and effective. And by the way, it's not new. Here's the thing, it's totally not new, and people in EMS know this. Naloxone's been around for many decades. Unfortunately, it was only kept in the back of an ambulance or a hospital emergency room. And so what's happened since around 2015 or so, police departments were encouraged to consider equipping their officers with naloxone because of the overdose problems, and we'll get into that in a second. Police officers did carry this. Before 2015, 2017, if we rolled up on a medical call, we get it there ahead of the ambulance, which often happens since we're out rolling around the streets during our shift, and we're usually the first ones there during medical calls. If we recognized it was an overdose because of heroin or fentanyl, something like that, we had to wait for the EMS to arrive to administer this life-saving medication. Well, thankfully things changed, and so this became more available. And the other point I want to make too is, and I was out in Western PA back in 2017 when I was in the Attorney General's office. We had a good discussion about this with a group of EMS and police officers and health officials. And what we said at that meeting was we encouraged police departments to obtain this and carry it, even if you didn't think it was your job as a police officer to carry this medication, that EMS should, handle it. Carry it anyway, because drug sniffing canines, they come across heroin or fentanyl and they sniff that out. They can get some of the grains into their nostrils. And there have been cases where a police officer, either a dog handler or someone at the scene that's a police officer, has been able to use naloxone to save the life of their canines. Secondly, though it rarely happens, there are times that police officers during the course of their duties needed to have naloxone there really to save the lives of their colleagues. So we'll get into that a little bit more, because I don't want to paint this as we're in total danger when it comes to the presence of fentanyl around us. Naloxone itself, it's not a substitute for medical care. So you may roll up to a medical scene where someone has overdosed, maybe called in saying, hey, this person's been laying in a park for 2 hours and they don't look right, they're barely breathing, and you roll up there and you administer naloxone. We also need to strongly encourage that person, once they recover, to go to a hospital. And why is that? Because those chemicals that are in the person's body, whether it's heroin or fentanyl, they're swirling around the bloodstream. And so when you use naloxone, we're giving a 30 to 90 minute window opportunity for that person to not be under the influence of that swirling substance in their system. But after 30 minutes, 90 minutes, those substances, heroin, fentanyl, are still rolling around the system. And once this wears off, they'll reattach to the brain and cause that respiratory failure. And so people really do need to take that ambulance ride to the emergency department and have a few hours of letting that substance get out of the system. In the emergency department, they get administered naloxone, oftentimes intravenously, until that drug is flushed from their system. When to use naloxone? When you respond to an overdose from an opioid, like heroin, like fentanyl, you first take a look at the person and evaluate what you see. And I can tell you this, the first thing you will recognize is the respirations, the breathing. What happens in an opioid-related overdose is you'll witness slow or shallow breathing. The first time I saw it back in the 1990s, we were following a guy from the suburbs into Philadelphia where he bought his heroin. His girlfriend was driving, and on the way back, I saw him slump over, and he was both a dealer and a user. He shot up his heroin, cooked it up in a spoon and shot it up outside the dealer's house. He immediately slumped over, and then as his girlfriend's driving away, a few blocks away, she's trying to get him to wake up. She kept pushing him and looking at him, talking to him, and she began to panic. So she turned her car around, went back to the dealer's house. The group of people outside the house just began to yell at her and tell her to drive away. They didn't want to have an overdose right in their street out in front of their house. So she drove away, and she drove all the way back to the suburbs, kept pushing him up, getting him upright, and finally I just pulled the car over. When I walked up to the car, he had his syringe laying on his lap, blood coming from his injection site, and I just did a pulse check on him, and his pulse was racing, trying to circulate the little bit of oxygen that it had left in him. But about every 15 seconds he inhaled. So he breathed, his respiration was 4 times a minute, 15, 20 seconds. And so we had EMS roll. Again, I didn't have Narcan, it's 1990s. But I could have simply administered Narcan and he absolutely would have recovered at the scene. He wasn't dead, he wasn't gone. It was only heroin at the time in the 90s. There's no fentanyl out there. And I could have absolutely saved his life. However, we didn't have it. So EMS came quickly. I helped them put him in the back of the ambulance and I rode with them to the hospital. They were able to find a vein and they gave him an intravenous naloxone, and on the way to the hospital he woke up. He did fight a little bit. It's not a good feeling to be Narcan. It's not a great feeling because he immediately went through withdrawal. He's a very, very heavy user and he was not happy. So we get to the ER. The emergency doctors came to see him. I stayed with him. The doctor says, "Oh, this is Earl. He's here every month." So whenever he re-upped with his Social Security disability check down in Philly, so he could both use and sell, he usually was a couple days of not using because he ran out. He didn't have any money. First time he would pick up, like the first of the month when he got his check, he would overdose. So every 30 days, the medical staff there were telling me he's overdosing every month. The other thing you'll recognize, not just slow or shallow breathing, but difficulty breathing, choking sounds, gurgling, like a snoring noise, and they can't be awakened. So these are the classic signs: respiratory issues, failings, barely breathing, laboring to breathe, choking, sounding like a person is choking and gurgling and snoring. And when you try to wake them, shake them, do a sternum rub, just using your knuckles, rub up and down the bone in the middle of their chest. It's very painful, and that sometimes will wake someone up. But if you can't awaken them, this is a good sign that you need to consider getting your Narcan ready. Also, full unconsciousness, completely unresponsive. Because of the lack of oxygen, you'll see the lips turn blue or purple, fingertips turning those colors because of the lack of oxygen. Overall graying of the skin. Those are the sort of things that you'll see. The other thing I suggest, based upon my experience and a lot of other people's experience, is if you have any thought that maybe this is not an overdose, it's some other type of problem, take a look around. What do you see? Do you see injection sites, track marks on their arms, around the sides of their head, at their neck, on the back of their palms, or the presence of a syringe? Now remember, you can snort heroin and fentanyl. So how about bags, empty bags or full bags? Usually the person is using and they start to overdose. They're not going to hide anything. It'll be right there and plain and simple. Or you roll into somebody's house for a medical emergency and you see a bottle of pills. Glance over, take a look. Are they Oxycontin? Are they Percocets? Are they opioids? Those are the other sort of visible signs that you're getting pretty good with your diagnosis. Shallow breathing, labored breathing, lips turning blue or purple, or their fingernails, track marks, whatever it might be. These help you confirm that it's an overdose. But again, if you don't see any paraphernalia laying around, it's still okay to use Narcan. According to the manufacturer, and from what I've heard in the last 10, 20 years, Narcan has no negative impact on a person. Earlier in our training, we talked about how opioids are a natural chemical within our system, within our bodies. And one of the reasons why we know that is our brains are equipped with a neurotransmission receptor called an opioid receptor. And so, listen, scientists studied this and they identified the presence of these opioid receptors that we have in our central nervous system, in our brains. Those receptors are there for a reason, because the natural production of of opioids within our own bodies is a reality. And so what happens though is when someone uses an opioid, whether it's prescription medication or heroin or fentanyl, that when that's in their system, those opioids fit nice to the opioid receptors in our brains that are already there. It's not just people that have addiction issues that have these receptors, we all do. If somebody were to shoot heroin or fentanyl or snort it or take too many medications that are opioid related or take a pill and crush it up and snort it, that's an opioid, they fit onto those receptors. The more receptors that get outfitted with the opioid, the more danger of an overdose there is. Also, the purity level of that opioid fitting onto that opioid receptor has an impact as well. As we talked about, the impact is respiratory failure. It's feeling good, but the more opioid receptors that get hit with opioids, or the more powerful and lethality of those opioids that hit those receptors and stick on there, with a greater chance the person will slowly stop breathing. When the opioids are flooding those receptors, the brain forgets to breathe. Doesn't feel like it's necessary. So that's what causes the opioid impact of not breathing. The solution to that is to get those opioids off the receptors. Now there's nothing we carry, nothing a hospital carries that can rid the system of the opioid. It's still going to go through the bloodstream, but how do we get the opioid disengaged with that receptor? Well, that's what Narcan's all about. Naloxone happens to fit on those receptors and actually kicks off the opioid. Now the opioid kicks off, doesn't go out of the body, it just gets circulated through the system, but the naloxone fits on that opioid receptor for 30 to 90 minutes, and really it's almost immediate. Within a minute, 2, maybe up to 3 minutes, once that naloxone kicks off the opioid of that receptor, for 30 to 90 minutes, breathing gets restored. And so a person all of a sudden begins to breathe again. The goal is to get this into a person's system so that that process could take place. And thankfully, it's a fairly quick process. It may not seem very quick to you when you're actually doing this the first time. You're seeing a person appearing to just pass away. But once that naloxone gets in the system and attaches to those receptors, that breathing gets restored automatically. Now I mentioned fentanyl a lot because early in our training, fentanyl was just coming about in a greater way. In Pennsylvania, we have fentanyl. We have 24 fentanyl-related substances that have been identified here in Pennsylvania. So it's not just generic fentanyl. It's all these other carfentanil and a bunch of others that are out there. But now fentanyl's all over the place. What about fentanyl? Will it help that? Yeah, fentanyl's an opioid. It's a lot more powerful. You may have to administer more than one dose of Narcan to a person because it's so powerful, but this will counteract the impact of even fentanyl. It's a synthetic opioid. It's very fast acting. It doesn't last long, but it's very fast acting. This chart, it shows that much heroin can cause an overdose. Whereas carfentanil and fentanyl, you need very little bit of it in comparison to heroin. That's how lethal it is. All right, so let's talk about first responder exposure to fentanyl. Let's just talk reality about this. I told you fentanyl can be present in a variety of forms. It could be a powder, it could be tablets, capsules like pills, it could be in a solution. I think you all know what fentanyl looks like, and if you don't, take a look at what others have seized in your department. Inhaling fentanyl, right, if it becomes airborne, and inhaling that can lead to harmful effects. That's a lot different than simple skin contact. So though it looks like a powder, it really is a crystallized powder. If you were to touch it, now listen, we all should be wearing gloves when we think we're going to come across something dangerous, right? And so we should be wearing gloves. But even if you incidentally contact fentanyl with your hands, your fingers, as long as you don't put your fingers in your eyes, your nose, or your mouth, what they say is that this will not be absorbed through the skin, certainly not easily. If you have an open cut, yeah, that could happen. Even when you're wearing gloves, if you're at a scene, If you touch fentanyl or any other substance, really, if you start to use a gloved hand to rub your eyes, your face, your nose, your mouth, yeah, you could absolutely put that into your system, and it can be harmful. What we have found, and I've been at scenes like we had a bunch of agents in Philadelphia hit a table house. In other words, they call it tables in Philly, where a group of people are at a table and they're bagging up heroin, fentanyl, cocaine, whatever. And they sit around these tables and they sort of prepare the product, put it in the bags for the street sales. And so one time we hit this place, it had about a kilo, they had a kilo of fentanyl on the tabletop, and they're all there with their gloved hands and masks, and they are actually putting it in the bags for sale. And when we hit the place, they jumped up, their knees hit the table, and about a kilo of the powder went airborne. They ran out the back door, were captured, but the police officers that chased them went through that cloud of dust. And every one of them had symptoms of being under the influence of fentanyl at the scene. Here's the good thing, they all carried Narcan. And so while they were waiting for EMS to come for themselves, they were able to either self-administer or give each other Narcan. They experienced some headaches from it, and that's about it. It's been often pointed out to me that even at that scene, it doesn't mean those officers were suffering a fatal overdose, but they started to feel the impact of the fentanyl, and though they're very strong and courageous people, began to panic. I still applaud them for using the Narcan that they had on them in preparation for EMS to come and make sure that they were okay, and some went to the hospital. I guess I'm saying all of this to say, let's not panic. When we're in a scene, we're doing a search warrant on a drug house, or we're doing a car stop and somebody's overdosed possibly with fentanyl with it, we don't want to treat this like it's anthrax. It's not that type of substance. We have to be very careful. In fact, when I was in BNI, we bought every BNI station. We had 8 of them around the state, including one just outside of Pittsburgh. We bought these aquarium filtered systems where when we do test bags of fentanyl or heroin, the agent or the local police officer could put a mask on, gloves, and then go inside this aquarium that had a ventilation system and do your field testing inside the aquarium. A lot safer than doing it roadside or in somebody's house with a ceiling fan. We need to take precautions, but we shouldn't be panicked. And by the way, I don't think anybody does. I often tell people that are not in law enforcement that police run towards the sound of gunfire. They don't run away. So I know you're not afraid of fentanyl. Just be cautious with fentanyl. Just be cautious when you're around it. Masks and gloves are fine, and if you don't have that, you need to take custody of some things. Make sure you wash your hands, soap and water afterward. All right, so here are the basic overdose response steps that all of us would take. These slides that I'll show you are sort of written and drafted for really not first responders, but the members of the public. These are a good go-by. Check for signs of an opioid overdose. That's step 1. If you can't get the person to wake up, if they're unresponsive, make sure you're doing everything you can do to sort of get them to wake up. Shout to them, gently shake their shoulders, do that sternum rub that I talked about. And then obviously for the public, call for help, 911. And then for you, make sure an EMS is rolling towards you. So don't wait until you use Naloxone. Get EMS going, because you have an unresponsive subject and they may or may not be overdosing, but even if they are overdosing, you want EMS there to take over the care of that patient, and then you go about your law enforcement duties. Let EMS know, hey, person's not breathing, I expect it's an overdose. For the public, we say make sure you share the exact location and whether or not you're using Narcan. I think it's important for us to say as well, hey, I'm going to utilize Narcan. So that's recorded. Following that, step 3, administer the Naloxone. It can be given in different ways. Some of the medications for Naloxone are intermuscular, so we don't actually train on that because most of our police officers in the United States, certainly in Pennsylvania, are using that medication that is a nasal inhaler. When you administer the Narcan, which is about 4 milligrams of strength in there. You have a box and you open that. By the way, all these things that I'm teaching you today, they're printed right here on the box, and there are also instructions inside. Each kit comes with manufacturer's directions and comments, which you can certainly read, and then you have the 2 doses. So you simply peel back the back side of this kit and you pull out the device. The device is like this. You simply place 2 fingers at the top, and then you see that pinkish color plunger that's there. So you get your thumb on that. All you do is you try to close one nostril, put it up a nostril, and then you plunge it into the person. You plunge it into the nostril. You plunge it, there's no more medication left in this. So you put that aside. If you need a second dose, you have one in your kit. Maybe you have multiple doses in your car. They say just select the other nostril if you have to use it again in 2 or 3 minutes. Very simple. It's not like CPR. It's not like rescue breathing and many types of first aid that can often be kind of complicated. It's very simple to use. So then what do? You obviously want to see their breathing restored. And so you put the person on their back, placing one hand under the chin and in the forehead, and you sort of open up that airway. Make sure that airway is open so that as the naloxone's working, the person's breathing gets restored. You want to make sure that that sort of is lined up. Just like we would do for rescue breathing. Make sure that there's a clear pathway from the mouth to the lungs so the person can breathe. Listen, make sure there's nothing blocking the throat area. Rarely, but sometimes it happens. The syringes that people use, often they'll clinch the cap in their teeth and they'll prepare the injection of the heroin or the fentanyl, and that cap stays between the teeth. If the person starts to get under the influence and they loosen the grip of the cap of the syringe, sometimes it gets inhaled. And so that could compromise a person's breathing. So just make sure that's not there or anything else that's blocking the breathing. Make sure the airway is clear. There are times that rescue breathing will really assist naloxone in restoring a person's breathing. Be patient, because my colleagues have seen people their breathing gets restored without any rescue breathing whatsoever. But if you have a one-way valved breathing mask, that's really good to have when you're on patrol carrying Narcan, because the cause of death for opioid-related overdoses is respiratory failure. And so if you can assist the person by giving rescue breaths every 5 seconds, that can be very helpful. In addition to that, as you probably are aware, there's a substance out there that's polluting the drug supply all over Pennsylvania. We think it started in Philadelphia, but it's all over Pennsylvania, and that's xylazine, or known as tranquilizer, or tranq. And that's being mixed into the drug supply and certainly being sold in southeastern PA as tranq, straight up the street dealers telling people, I'm selling this tranquilizer. Unfortunately, tranq, or xylazine, is not an opioid. And so if somebody's under the influence of tranq and they are not breathing or breathing well, Narcan won't help them. It's not an opioid. The tranq hits different receptors or different part of the brain. Sometimes, and certainly in the people I know who are involved on sort of street type of work, they always provide rescue breathing. Tranq has so polluted the drug supply in southeastern PA. Without rescue breathing, people that are under the influence of tranq will die. Rescue breaths, oxygen is clearly important. We think most EMS do that, knowing that tranquilizer drug is out there. And with rescue breathing and with oxygen, someone can survive. It just takes time. With opioid-related overdoses, Narcan, naloxone is clearly the medication that can save a person's life. For the public, this step is clearly important. We already know it. But stay with the person until help arrives. Connect them with the medical professionals. As far as the reaction, most people are not very happy with being Narcan. Even though you're saving their life, they get mad because they've just lost that high that they were experiencing. They may become agitated. Also, don't forget, it's like immediate withdrawal for them. That opioid withdrawal and those symptoms, the pain, the shaking, the vomiting, that could all occur somewhat close to you administering the naloxone. And you can have a conversation with somebody after they come awake. It's not going to be a great conversation because they're struggling. Try to encourage them to seek medical help as best you can. What's very important in this whole reversal process of opioid overdoses is make sure you put that person, after you administer naloxone, put that person in that recovery position with their head on their side and their arms and legs in that position that you see on the slide. This is called the recovery position. People do get nauseous and sometimes do vomit, and they could choke on that vomit. That's really important to put them on their side in this recovery position while you wait for EMS to arrive. When do you administer a second dose of naloxone? So you administer it, you don't see any impact of it, they're still laboring terribly with their breathing, they're not coming around, they're floating in and out of consciousness, and it seems like they're still struggling. If a person has not responded to that first dose of naloxone, in 2 or 3 minutes, give that second dose. And so sometimes the lethality, the powerful nature of the substance needs just a little bit more naloxone to kick it off of the opioid receptor. So go ahead and do that. If there's still no response, you can give additional doses every 2 to 3 minutes until the person responds. Now make sure you're patient though. We don't want to give them too much, not that it would hurt them, but the more we give, the worse their withdrawal symptoms will be. And we don't punish people for substance use, right? So make sure that you be patient with this medication to work and not give multiple doses like one after the other. Give it 2 or 3 minutes between administering a dose. So let's just review the essential overdose steps. Number 1, check for signs of an overdose. We talked about that. The labored breathing, the lips and fingernails being blue or purple from a lack of oxygen. Check for signs of an overdose includes, taking a look around. Is there a prescription pill bottle that you see, or some pills in a bag, or empty or full bags of heroin or fentanyl, a syringe, track marks? So those are the sort of signs that you're looking for. Make sure that you have notified EMS to come to the scene so they can take over. Step 3, administer the naloxone. Remember, wait 2 to 3 minutes between administrations of this medication. Check their breathing, make sure that their throat is clear, there's not choking involved, there's not something in their throat or in their mouth that's causing the labored breathing, and support that breathing. If necessary, give rescue breaths. And then, of course, we wait for EMS to take over. So after we administer naloxone, we should anticipate, and I'm sure that any one of you that have seen this, you would agree, some people get agitated. The withdrawal symptoms of an opioid overdose are absolutely present when you administer this medication. It starts to put them into an immediate withdrawal. And not only is it nauseousness, vomiting, cravings, and all that, but it's actually very painful. It's physically painful. It's something I didn't know before I met some medical folks that explained that to me. When it's safe to do so, be aware of your body language, how you're standing with a person or sitting with a person or kneeling next to a person. Be trauma informed. Make sure that they feel safe, secure, that they're not going to get harmed. When it's safe to do so, listen, your safety is my biggest priority. So make sure there's no weapons around. Make sure that you initially are in a defensive position so that if they become overly agitated, be okay. But do be aware with the person. And I'll give you a quick example of that. There's somebody that I met a number of years ago that overdosed, described to me the last overdose he had in Pennsylvania. When he woke up from overdosing and the officer was standing there with empty Narcan in his hand, the officer looked in a certain way that conveyed empathy. And he had overdosed several times before. He went to literally 18 treatment centers before this day. And for some reason, just the way the officer was standing and talking to this person, his name was Brian, it conveyed to him that this officer really cared about him. Most of the times when he overdosed, whoever was administering the Narcan was treating the person not so well. Was certainly not trauma informed, at least that's the way he describes it. But this officer stood in such a way and actually said to him, "Oh my God, I thought I lost you." And for whatever reason, that impacted Ryan. If this uniformed cop thought I was a human being and not just a piece of crap and treated me like a human being, that clicked in his head. The next time he went to treatment, right after that overdose, it stuck with him. And so when I met him, he was about 5 years into recovery, and we were able to connect him with the officer that saved him that last time. As I said, there's a caution to this. Those opioids within the system are still swirling around. Narcan lasts about 30 to 90 minutes. So after that time period when Narcan wears off and it gets off the receptor, opioids will reattach. What do people feel after they get Narcan? They feel the cravings, they feel the withdrawal. They're very likely to use again. And quite frankly, they have it in their sock, their hot bags, the ones that cause the overdose, the powerful, whatever it is. Could be heroin, could be fentanyl. They will use that again. And unfortunately, that's the nature of addiction, is despite the harmful consequences, like using the same stash that they overdosed on, they will likely do that again. Now, they're not stupid. They're smart people. They'll probably use about half or just a little bit, but that doesn't mean they won't overdose again. So sometimes people overdose more than once a day. Can't exchange what you bought, but sometimes they don't even seek out a safer product. And that's just the nature of addiction. It's not about being smart or not smart. It's just the nature of substance use disorder. All right, can we have effective communication after a Narcan reversal? I will tell you this, it's not the optimum time for you to convey what we teach in our training, how to motivationally engage people in wanting to get help and seek treatment. These are emergency situations that are very traumatic for someone, and much of what we say to a person will be lost later that day because they suffered a tragedy and they're also in withdrawal. But it doesn't mean we can't at least start the process of communicating then. Obviously, the person's not under the influence of the drug. Now they're under the influence of the withdrawal, painful withdrawal, but they will probably remember how they were treated more than they will remember what you said. Show empathy, do slow down your rate of speech, speak more slowly, calm tone of voice, demonstrate understanding. And if they say something to you that you don't understand, it's okay, ask for clarification, be genuine. Your body language will probably rule the day. They'll never forget how you treated them or how you handled yourself in that situation. Try not to be judgmental. Don't stand there like in judgment, wiping your brow and shaking your head. Try to have a non-judgmental position. As I say, make sure you're safe. Like, I don't want you to ever forget about your own safety. One of the greatest things about Naloxone is the fact that it is free. There's no cost to you, to your department. And that's because a ton of federal money has been put into this Naloxone availability program. We call it POP, or PA Overdose Prevention Program. And this is something that you can go online, Google PA Overdose Prevention Program. Your department could do this. You could do this individually. Nonprofits and others that would like to have Narcan, it's all free. You simply fill out a form online, send it in, and they will ship it right to your department. I've done this. I did it early when this program just started, so it took a few months to get the amount of Narcan that I wanted. It's quicker now, so make sure you order it well in advance. It is at no cost to you or your department. Now, another thing that we were asked to do, and I think it's important to remember, that you have state government officials and federal officials that are not out there on the street with you. They don't know what you're experiencing unless you tell them. And so it's really important that whatever avenue your department should be reporting on using Naloxone and responding to overdoses, that you do fill out those forms completely. And so the data that is collected through all of us reporting on what we're seeing and what we experienced in our profession It's really important so that they understand what it is that they need to do to support you. So it makes total sense. I mean, this POP program, the overdose prevention program, they're relying on data to see how much Narcan they should get and at what strength they should get it. It's critical that we report those things. Fill out the forms, those incomplete boxes that we're not sharing, the information that we have the information to share. They need to understand what you're experiencing. They're in offices in the Capitol and in Washington, D.C., and they really need to understand completely what you're experiencing. There's really two methods, and they're sort of combined together in Pennsylvania. PA Overdose Information Network, called ODIN, and that's available through your JNet portal. You'll see the form there. I was involved just very slightly with creating the form, and it does report on date, time, location. Was it a fatal or non-fatal overdose? Did you administer naloxone? How much? It also you can report on the markings on the bag, the stamps, the color of the bag, so forth. And it all gets processed through PASIC in Harrisburg, and they take a look at all of this. If you're experiencing an overdose or two in your jurisdiction, you may not know that the neighboring jurisdiction or somewhere in the city near you, they're experiencing overdoses from these same bags. If you report it, they report it, everybody's reporting these overdoses, it will alert law enforcement that, hey, there's a particular stamped bag that is overdosing, killing people or overdosing people. We need to find out where this supply is coming from. OD map through HIDA, the High Intensity Drug Trafficking Program. There's one in Pittsburgh, there's one in Philly, and they have this great app called OD Map, and you put it on your phone, and you can literally from your phone report out on these things. You can take a picture of the bags and send it. It recognizes your location, so you don't have to put the date, time, location, and then you can answer all of those questions. These two programs come together at PASIC, and they can sort of read both of those reports and put them together. EMS has their own forms, and what we're being told from Harrisburg is that both law enforcement and EMS need to step up answering all the questions in all the fields. So I just share that with you. So if you remember, I said to you a few things that are really important. Well, all of it's important, but a few things that I want to highlight. Naloxone is not addictive. It does not get people high. It's not sought after by people that are addicted, engaged in substance use disorder. Because of that, there's a program that people came up with, and I like the program. Now, you guys have to think about it, but it's the idea of leaving naloxone behind. You know that when you respond to, let's say, somebody's house, and let's say it's a young person, and the parents are there panicking, you're administering naloxone, you're the hero of the day because their son or daughter lived. They get carted off to the ambulance. Well, what do you do next? What other thing could we do as a police officer, a first responder, that might help prepare the family in the event that this happens again? I mean, you and I know this could definitely happen again. The chance of somebody going to an inpatient treatment center and coming out and never using again, the chance of that happening on the first time or the fifth time is pretty slim. So someone can recover after one overdose, one Narcan administration, one treatment, and so forth. But generally speaking, this illness can carry over time until somebody really is ready to get help. And so that person is going to get eventually released and go back home. And so mom and dad, how do you prepare them in the event it happens again, the overdose? Maybe next time you're on a hot call and you can't respond as quickly, and EMS is tied up and they can't respond as quickly. Well, this medication's so easy to use, why not leave a box or two behind? This may require, and I'm sure it does, policy by your department. Very simple policy you can run by the solicitor and say, because of the safe nature of this medication, and it's encouraged by Pennsylvania state authorities, including the Department of Health, Department of Drug and Alcohol programs, we are going to leave behind Narcan to loved ones and others in the event that there's an overdose again. It has no street value. It's not like you're giving something valuable to them. You can't sell this on the street because nobody will want to buy it. It's free to you, no cost to your department, and it's free to many others as well. Doesn't get people high. The idea of it causing more risky drug use, it sounds like that's common sense. You might think, well, somebody's going to use more heroin if they have Narcan nearby and there's a friend nearby that can administer it to me, so I'll be more risky. Look, in reality, and I did 28 years undercover, that's not the way people think. They don't think, hey, because I have an anecdote that I'm going to shoot more dope. It's the desire to not be sick. That's why people end up using drugs, so that they don't feel sick anymore. Or even if it's to get high, they're not going to use drugs in a more risky fashion simply because there's an anecdote nearby. I mean, talk to people that are addicted and see what they have to say. And the bottom line is, I see the common sense nature of the argument. If I give Narcan, maybe they'll just use drugs more. That's, in reality, that's really not happening. Drug use is risky enough. And so it doesn't cause more risky drug use. It's free. You may need to develop a policy, a pretty simple policy that any solicitor could help you develop so that your officers can give this away. It does improve community support in this way. About 47% of our population is struggling with substance use disorder, either themselves or family members. And so half the population would likely be very appreciative that you have given a life-saving medication away to a family whose son or daughter is struggling with opioid addiction. I think it makes your department look good. If you ever could collect stories from a mom or dad or a family member that actually used the Narcan that you provided them, your department would be a superstar. Every life is important. With that being said, that's our Naloxone module. If you have any questions, email me at care@sju.edu. Give me your phone number and I'll definitely answer any questions you have. Thank you for listening. I hope you carry Naloxone on duty, off duty. I hope your department feels very comfortable getting free Naloxone. I've gotten hundreds and hundreds of doses of this for our training program and for some nonprofits that I work with through that POPP program. And if you are able to share your experience using this medication with me, just email me or we'll talk on the phone. I'd like to hear how you saved a life or at least tried to save a life. Make sure you carry this all the time. I appreciate you very much. Thank you.